This is a step-by-step demonstration of doffing of PPE while caring for COVID-19 positive patients, according to the Free State Department of Health. Extra equipment that you will require for the doffing is a container with disinfectant solution, as well as a double red plastic bag for discarding of your PPE. Your assistant in this case will need a surgical mask, one pair of gloves, and a plastic apron. When moving from the contaminated area to the transition zone of the designated doffing area, remove the overshoes first and discard them before entering the designated area. The first step of doffing is for the trained observer to inspect the PPE and check that PPE is intact and that there is no splashes or contamination on areas that's not protected by PPE. If your assistant does identify that there is something, they should put on a second pair of gloves and use disinfectant solution with a swab to wipe the contamination off the exposed area of the proceduralist. Thereafter, both the swab and the outside pair of gloves should be removed and discarded in the red bin, and their hands disinfected. Now we can proceed with the rest of the doffing procedure. Your proceduralist should first disinfect the gloves with assistance from the trained observer. The hand hygiene steps are according to the 8 steps of the WHO hand rub procedure. After the hands are disinfected, your assistant can assist you with removing the apron. Your assistant can untie the apron, lift the front area off, say that they are clear to prevent contamination of your hands with their hands, and discard the apron in the red bin. The PPE should now be inspected once again. Disinfect the gloves. Now remove the outside pair of gloves. Disinfect the inner gloves. Thereafter, remove the overgown. You can ask your assistant to untie the gown at the back and to drape the top part over the shoulders so you can touch the inside of the gown to remove the gown, and discard in the red bin. The aim here is to touch as little as possible on the outside of the gown. Disinfect the gloves. Then the healthcare provider can remove the eye protection and place it in the container with the disinfectant solution immediately. Disinfect your gloves once again. The reason for placing the eye protection in the disinfectant bowl is to prevent contamination when handing it over to someone that needs to clean it if it's eye protection that needs to be reused in another case. Now ask your assistant to help you remove the N95 mask. Lean over the red bin and ask your assistant to loosen the elastics and just let the mask fall into the bin. Disinfect your gloves. Then remove your disposable cap. Disinfect the gloves one last time before removing the gloves. Now practice hand hygiene with the alcohol rubbing solution on your hands. Thereafter, you should remove your scrub suit. If there's availability of a shower, take a shower and ensure hydration and comfort. The doffing procedure for the assistant will start first with disinfecting the gloves. And removing the gloves. Followed by disinfecting your hands. And removing the surgical mask without touching the outside of the mask. Disinfect your hands once again before removing the apron. You may ask someone to assist you with untying the apron at the back. And disinfect your hands once again. Now the doffing procedure of the healthcare provider and the trained observer is complete.